1 in 5 Americans is taking psychiatric drugs, and as many as 1 in 4 women may be taking more than one psych med right now. Chances are, if you're not currently taking psych drugs, you know someone who is. Yet, most people know surprisingly little about these medications. And what's more, they often take them because they believe some of the urban myths floating around about how and why psych meds work. Let's bust a few of these myths before you or a loved one decides to stop or start psychiatric drugs. Myth number 1. I need psych meds to treat a chemical imbalance. Many people think that depression is caused by low serotonin, and that taking antidepressants, also known as monoamines like Prozac and Lexapro, corrects this imbalance in the brain. But the monoamine theory was debunked in 1984, 3 years before Prozac even came out on the market, and then again in 1999, in 2000, and in 2010. And this isn't just the case with serotonin and depression. The same is true for dopamine and psychosis and every other neurotransmitter associated with mental illness. Okay then, why have so many patients been told that taking psych meds for their mental illness is like a diabetic needing to take their insulin to function normally? Maybe it's because the companies that made these drugs pushed this theory so hard in advertising campaigns, or maybe it's because doctors don't have a better way of explaining what these drugs do. Did you know that psychiatric drugs don't actually target a specific illness at all? Instead of correcting a problem like, say, the lack of insulin in type 1 diabetes, psychiatric drugs work more like drinking a shot of whiskey for stage fright or taking speed to help you get through exams. Does alcohol calm anxiety and even help you get to sleep at night? It sure does. And cocaine will keep you going even when you should be feeling exhausted. And even though everyone may respond differently to alcohol and drugs, a pint of beer is pretty much going to affect the guy with anxiety as it does every other guy at the bar. Antipsychotics like Abilify and Seroquel will slow you down and knock you out, whether or not you're schizophrenic. In fact, that's why they're prescribed off-label so often to people for things like insomnia. So, aren't there any biological imbalances that create mental health problems? Yes, and we'll talk about them in later videos. Just know that if you do have an imbalance, it's not the kind Pfizer and the other drug companies would have you believe. Myth number 2. Psych meds treat brain disorders. But what is a brain disorder? Look, brain scans of people with schizophrenia, ADHD, and even autism are no different than normal brain scans. You know which brains are different? The ones that have been exposed to psychiatric drugs. Even one of the most commonly prescribed antidepressants, Lexapro, has been shown in research to reduce the connectivity between cells throughout a healthy person's brain after a single dose. That's an altered brain in just a few hours. And multiple studies show that years of taking antipsychotics can actually shrink people's brains. Okay, but what about genetics? It's not about the genes. Researchers have been trying to find the schizophrenia gene since the 1950s. But despite all the big claims, there have been no confirmed discoveries of genes or genetic variants causing schizophrenia. It would be nice to say that psychiatric diagnoses and the drugs used to treat them were developed in response to rigorous scientific research, but this is how it really works. There seem to be kids who are normal except they are mischievous, violent, and don't respond to punishment. I dub them with minimal brain dysfunction. I have a bunch of hyperactive kids at my school that I'm calling normal but brain injured. Well, we took a vote and we're going to call it organic brain syndrome. Bro, I have this drug for narcolepsy, peeps. It's like cocaine. Sweet. Heard coke helps kids focus in school. Hey, we should give it to kids with OBS. We didn't like OBS, so we took another vote. And now it's, wait for it, hyperkinetic reaction of childhood. Never mind. Now it's attention deficit disorder. And it affects 3% of kids. We voted again. Now it's ADHD, more symptoms included. Now 23% more kids have it. But that's like millions of kids. Yup. But you have no biological or chemical tests that prove any of this. No worries. I'm just going to write like a mad ton of papers on it. It's genetic. If they don't take Ritalin, they'll become alcoholics. Now, even more kids have it than before. Scratch that. Now, 10% of kids need Ritalin. Dude, we like what you're saying. Cool. By the way, we have another great drug for kids. Cool. Myth number 3. You just need to find the right combination of meds. Remember how quickly some drugs can change your brain? Well, it's not just your brain. It's your entire body. In fact, some psych meds change your body so drastically that if you suddenly stop taking them, you could have a seizure or a stroke and die. If they can change your body chemistry that much, how does it make sense to constantly stop and start different psych meds? Besides, all the research we have on how to safely get people off psych meds is, it's not a lot. But these drugs have been around long enough and have been used so much that there is plenty of evidence to show how devastating and impossibly hard it can be to withdraw from every one of the drugs in all 5 classes of psych meds. And despite what many medical providers believe, recovery from psych drug withdrawal can, and usually does, take more than a couple of weeks. It takes some people years to withdraw, and if they've been hit really hard, that process can be extremely painful, as well as mentally and physically disabling. Luckily, even people who have been severely harmed by psych meds can and do heal. It just might take longer than expected.
Ain't nobody got time for that.
In fact, that's what makes getting off psych meds so difficult and confusing. The way these drugs can change your body while taking or coming off of them often looks like the original condition for which they were prescribed, or that it's getting worse, or that you've discovered new underlying mental and physical problems. And since there are no biological or chemical tests to determine if it's you or the drug, oftentimes, it's the patient's word against their doctor's. That's usually when patients are prescribed more and more psych meds or diagnosed with other health problems and given even more drugs. This is called polypharmacy. Even though polypharmacy has never been studied, it's really common and really dangerous. In fact, poisoning from many psychiatric drugs kills more people every year than heroin. Maybe that's one of the reasons why people diagnosed with major mental illnesses die 10 to 25 years earlier than everyone else. Myth number 4. If my doctor and the FDA approved it, that means it's safe, right? In an ideal world, yes, but in reality, the FDA regulating psych med safety is a bit like the fox guarding the henhouse. 1 in 4 FDA employees who approve certain medications ends up working for the drug companies they regulate. It's a revolving door of FDA employees and pharmaceutical companies, where for 25 years, the FDA has approved almost every single drug that has come through its doors. And during that time, those drug companies have paid $35.7 billion in fraud to state and federal governments. But it's the patients who pay the real price. At the very least, these lawsuits force drug companies to reveal what they are hiding from the public. You see, the FDA only requires 2 positive drug trials for approval. A company could have 12 studies that show their drug is harmful, but as long as they have 2 trials that show it works, they can still get it approved. In fact, half of all drug trial outcomes are buried, never seeing the light of day, meaning your doctor sees what they want him to see, and that's not even taking into account how the data is tortured and manipulated to make it say what they want. Like what happened with Paxil. What your doctors didn't know when GlaxoSmithKline published raving reviews about their antidepressant, especially in treating kids with anxiety and depression, is how the paid physician reps lied about the research, which really shows Paxil increased suicidality by 800%. And even though they paid $3 billion in 2012 for fraud, GlaxoSmithKline never retracted anything they said. And the next year, Paxil sales actually increased. And until recently, a bipolar med that's been around since the 60s had no label warning women or their doctors of the risks to babies, even though regulators in Europe knew about the problem back in 1974, 4 years before it was approved by the FDA. You really have to ask yourself, what doesn't my doctor know about the psych meds she's prescribing right now? Myth number 5, but people need them because they work. But do they work? Did you know that mental health disability rates for adults and children have skyrocketed since the introduction of drugs like Prozac in the 80s in places where we have the most access to psychiatric drugs, like the US, Australia, Denmark, and Sweden? If these drugs really help people, shouldn't we be seeing fewer of us disabled by mental illness, not more? Before the introduction of psych meds, in the past, depression was mostly a temporary problem. After a few months, around 85% of people who were hospitalized for severe depression just got better and rarely ever got that depressed again. Modern studies show the same thing. People just naturally get better, unless they take antidepressants. Then, depression looks more like this. And in research done by scientists outside the pharmaceutical industry, those who have no reason to torture the data, we see that antidepressants are hardly any better than placebo, and sometimes placebo works better. Do you know what this means? It means a lot of people on antidepressants may be getting better, in spite of the drugs. That's a powerful mind. And did you know that over 2,000 studies have shown kids on ADHD meds show no improvement years later in their schoolwork, their behavior, or in their relationships? Guess which kids do get better? The ones who never took ADHD meds. But what about the severely mentally ill, like people who are psychotic? They have to take meds, right? Well, actually, studies show recovery for people who develop schizophrenia are surprisingly similar to those with depression, where people who never take antipsychotics or only take them for a short time do much better than patients who take them long term. Look, no one is telling you to quit taking your psych meds or that you're awful if you try one. It's not like it's all that uncommon. In fact, please don't ever suddenly stop taking psych meds. Just know what they do and what they don't do. Being in the middle of a mental health crisis is kind of like getting shot in the leg by an arrow. It's hard to get around. Taking psych meds is like putting a cast on that leg. Will it help you get around? Yeah, and some people find that helpful. But when the cast stops working or it's time to take it off, the arrow is still there, only now you may have an even bigger problem. The good news is, addressing the arrow, the real source of the problem, has even better results than drug therapy. There are so many options that really do work. Dropping the med myth means you're not doomed to a lifetime of psychiatric illness. You can take control back of your life's narrative and discover real solutions. Check out the resources in the drop-down menu below this video to explore your options, and stay tuned to learn from experts who've helped people sustainably heal for life.